We've all heard that location, location, location is key when it comes to real estate. But does the same rule apply to where we inject our GLP-1 medications? Let's find out. Hey everyone, welcome back to the channel. If you're new here, I'm Stephanie, and today we're talking about a really common question when it comes to GLP-1 medications. Does the injection site actually affect how well the medication works or how bad the side effects are? Stick around because we're digging into what the science says, what the patients are reporting, and what might help you get the most from your medication. First off, let's have a quick refresher on GLP-1 medications. GLP-1 receptor agonists are a class of medications originally designed to treat type 2 diabetes, but now they're widely prescribed for weight loss as well. Popular brands include the Semaglutides, Ozempic and Wegovy, and the Tirzepatides, Mounjaro and Zepbound. These are usually weekly injections in what's known as a subcutaneous injection. And subcutaneous injection, that means you are injecting your medication into the layer of tissue that's just beneath the skin, but above the muscle. In other words, you're looking for that fatty tissue in between. Here are the main sites where GLP-1 injections are typically recommended. Abdomen, which is generally preferred because medications are absorbed more quickly and consistently there. Your injection location should be at least 2 inches away from the belly button to avoid the scar tissue from the umbilical cord, which is more sensitive. Your thighs, you should use the middle outer part of the thigh to inject. The best area is 1 hand length below your hip and 1 hand length above the knee. The inner thigh is generally avoided for injections because it can be more painful and uncomfortable due to higher concentrations of nerves and a thinner layer of fat there. In your upper arms, the back or outer part actually, subcutaneous injections are absorbed more slowly than intramuscular injections, making them suitable for medications that need to be absorbed over a longer period of time. So in terms of effectiveness and side effects, does it matter where you inject your GLP-1? Most clinical studies suggest there is no significant difference in effectiveness based on the injection site. The drug absorbs well enough from all 3 locations as long as you're injecting into the fat layer, not the muscle. But there is evidence that suggests the abdomen tends to absorb medication faster due to the generally better blood flow in that region. And it's important to note that the factors like body composition, overall health, and injection techniques can influence those absorption rates as well. There are real-world users, as we all know, and a few smaller studies that suggest subtle differences in absorption rate and time to the peak concentration of the medication. For example, some patients say they feel less nausea when injecting into the thigh versus the abdomen. And other side effects like cramping or site irritation might vary slightly based on the injection location. Other observations by users include abdomen injections tend to be the worst spot for nausea. Less irritation or bruising in the thighs or upper arm, and better tolerance by rotating the sites regularly. So a tip would be if you're experiencing side effects, it might be worth a try to move to a different site for a few weeks to see if your body reacts differently. To reduce side effects and get consistent results, rotate your injection sites regularly, use proper technique as recommended by the drug manufacturer. Avoid injecting into scar tissue, stretch marks, or bruised areas. And talk to your doctor if you're unsure or you're experiencing unusual side effects. So to answer the big question, does the injection site impact effectiveness? Not significantly. Can it affect side effects or comfort? Yes, for some people it might. Ultimately, it comes down to listening to your body, and what works best for one person may not for another. Somebody recently commented on one of my videos and suggested I try the thigh to see if maybe I experienced less nausea than my typical abdomen shots. I did try it. I was willing to try anything, but unfortunately, I experienced an even greater amount of nausea from that shot. Now, I can't say for certain that it was the location, but I definitely didn't experience a positive change. But remember, not everybody's body reacts the same way. Many others seem to have better luck with nausea when injecting in the thigh. If you've noticed differences in medication effectiveness or side effects depending on where you inject, drop a comment below. I love hearing your experiences. I really do. I'm not saying I won't change injection locations again, but it was a really rough week, so I'm going to give it a little while before I try the thigh again. As for the arm, I still haven't figured that one out. I've seen people do that on their own. It just looks and feels awkward to me. So if I decide to go the route of the arm, I think I might ask my husband to help out with that injection. Thanks so much for joining me today, guys. If you found this video helpful, don't forget to like and subscribe for more real talk about health, wellness, and medications. See you in the next one.